Drugs/alcohol testing. Introduction and background. Module 1 Package 5/2015. 1. Learning points. Why test for drugs and alcohol? Types of testing. History of drug testing. Choice of material for analysis. Alcohol, nature, physiology, effects. Commonly abused illicit drugs. Analytical strategies. Sample collection features. Review of results. Beating the test, sample adulteration and tampering. Module 1 Package 5/2015. 2. Why have a drugs and alcohol policy? Most people spend a large proportion of their lives within the workplace. Consequently, health and safety within the workplace has evolved significantly over past decades and is controlled by statute. Employers are legally responsible for the health, safety and welfare of their employees, and government encourages employers to introduce a substance abuse policy to help fulfill these legal obligations. Module 1 Package 5/2015. 3. Why test for drugs and alcohol? Testing is a tool which can be used to support the policy, particularly in industries where health and safety of employees and members of the public is of particular concern, for example heavy industry, public transport. Introduction of workplace testing is usually done in collaboration with the workforce, and trade unions and management must have good understanding of issues involved. Common types of testing. There are 3 common circumstances where testing is appropriate: pre-employment, unannounced, and for cause. Pre-employment testing is usually part of the recruitment and selection process, sometimes carried out as part of a medical examination/health check. History of workplace testing. All began in early 1980s in USA as a result of serious railway accident. Cannabis use was considered the major factor. The emerging crack cocaine epidemic and the political environment of President Reagan's war on drugs. As a result, mandatory testing of federal employees in the United States was introduced. Many millions of drug tests occur annually in US. Material used for testing. There are a number of matrices which can be used to detect the presence of drugs in an individual. These are urine, breath, oral fluid and hair. Urine was the first body fluid to be used routinely for workplace drug testing and is still widely used. Most drug abuse can be detected in urine for up to 3 or 4 days after last use. Cannabis can persist for longer in urine, up to 3 or 4 weeks in heavy users. Alcohol. Alcohol misuse is regarded as the 3rd largest health problem in the UK after heart disease and cancer. Although moderate consumption is normal, abuse, misuse or dependence can lead to serious health problems. Chronic effects of excessive alcohol consumption include liver disease, heart and circulation problems, throat and esophagus cancer, mental health problems, impotence, infertility. Alcohol physiology. What happens to alcohol when it is consumed? Initially, alcohol is absorbed into the blood, whereby it can exert its effects. Absorption of alcohol into the blood is rapid. The blood alcohol level attained depends on amount drunk, time period of drinking, presence of food in stomach, weight and gender of drinker. The elimination of alcohol is relatively fast in comparison to most drugs. This is largely due to the way in which the body metabolizes alcohol, with the blood alcohol concentration decreasing at a fairly constant rate. This elimination rate is independent of the alcohol concentration at a particular time, allowing us to back-calculate the alcohol level to an earlier time. The elimination rate cannot be influenced with black coffee, cold showers, fresh air. Module 1 Package 5/2015. 10. Safe alcohol consumption. Moderate alcohol consumption is not considered harmful. Excessive drinking, however, is harmful to health, and because of this, the UK government has issued guidelines for safe alcohol consumption. These are as follows. There are variations in the strength of alcoholic drinks. Note that a single bottle of spirits represents a man's entire weekly alcohol allowance. Module 1 Package 5/2015. 12. Effects of alcohol. Alcohol is depressant of the central nervous system. It depresses parts of the brain which inhibit normal restraint, resulting in classic symptoms of alcohol intoxication. The effects are related to blood alcohol concentration, BAC. This, in turn, is related to breath and urine concentrations. Module 1 Package 5/2015. 14. Illicit drugs. These are substances considered as a threat to public health and safety. They are controlled by statute under the Misuse of Drugs Act, 1971. Cannabis, Class B. Cannabis is the most popular drug of abuse in the world. According to the UNODC World Drugs Report 2011, most cannabis resin originates in Morocco, Afghanistan, India, Lebanon and Pakistan. Cannabis is a natural product which is easily grown as a dioecious plant, with the male/female plants being indistinguishable until flowering. Cannabis plants. Module 1 Package 5/2015. 17. Amphetamine, Class B. Amphetamine is a chemically manufactured stimulant drug of abuse, usually found as powder in a paper wrap. It can be taken orally, sniffed or injected. The drug leads to excitation and reduces feelings of tiredness. It can make people overactive, agitated or even psychotic, delusional. Effects are followed by a long, slow come down, making the user feel irritable and depressed. Amphetamine increases blood pressure and puts a strain on the heart, potentially giving rise to stroke or heart attack. Ecstasy, Class A. Group of drugs chemically related to amphetamine. MA is the most common ecstasy drug, widely used for its stimulant and socializing properties. Usually found as tablets with distinctive logo. Street names for ecstasy include ecstasy, love doves, Mitsubishis. Ecstasy drugs, or their metabolites, can persist in the body for several days after use. Module 1 Package 5/2015. 19. Opiates, Class A, morphine. Opiates are a broad group of drugs. Although they are widely used in medicine for their analgesic properties, they are subject to abuse. Most opiates are derived from morphine, which is extracted from the opium poppy. Heroin is a derivative of morphine and is a drug preferred by opiate addicts. When heroin is used, it is rapidly converted to morphine in the body. Heroin is usually found as a small quantity of brown powder in paper twist. It can be taken orally, inhaled as vapor, chasing the dragon, or injected. Cocaine, Class A. Cocaine is a powerful stimulant drug extracted from the coca plant, native of South America. It is usually found as white powder, usually abused by nasal insufflation, snorting. Larger quantities of cocaine can be found in the form of compressed blocks. Crack is a term used for the freebase form of the drug, which can be smoked. Because the drug in this form is absorbed rapidly, it has an even higher potential for harm than cocaine powder, salt. Benzodiazepines, Class C. Benzodiazepines are a large group of drugs used medicinally as tranquilizers, hypnotics or muscle relaxants. Their primary feature is sedation, and although extensively prescribed in medicine, they are widely abused. Common benzodiazepine drugs include diazepam and temazepam. Some benzodiazepines, not marketed in the UK but sourced on the internet, include phenazepam and etizolame. Prescription drugs. Although workplace drug testing and substance abuse policies are directed towards illicit drugs and drug abuse, many prescribed drugs are often subject to abuse, for example benzodiazepines and opiates. Analytical strategies. The analytical process incorporates 2 main stages: screening and confirmation. Screening. The screening stage can take place in either the laboratory or on-site, at the time of collection. Screening tests are based on group-specific immunoassay analysis and are mainly designed to identify those samples which will be regarded as negative. A positive screening test result means that the presence of a drug within a particular drug group is suspected, and further work is needed to confirm the identity of a particular drug, if present, and measure its concentration. Collectors note, a positive screening test does not necessarily mean that a drug is present. The sample can only be regarded as non-negative at this stage, and further work will be required. How are positive and negative results distinguished? In forensic casework, the presence of a drug at any concentration may well be of significance. In workplace drug testing, however, the sensitivity of the analysis must be controlled such that low drug concentrations are not reported as positive. This is to reduce the potential for low-level or inadvertent exposure giving rise to positive results and unwarranted sanction. At both the screening and confirmation stages, there must therefore be a way of distinguishing positives from negatives, even though a particular drug may actually be present. Laboratory analysis features. Laboratories used to analyze samples for drugs are fully accredited to UK 17025, ISO 9002. Full chain of custody conditions are in place and the results are fully defensible in court. Analytical and collection practices comply with European guidelines set within the drug testing industry. Module 1 Package 5/2015. 26. Collection procedures, features. When samples are collected, oral fluid, urine or hair, strict procedures are adhered to. Using these principles, the integrity of the results can be assured. Some features of the collection process are as follows. Secure and controlled collection environment. Tight collection protocols and documentation. Donor interaction and identification. Strict chain of custody procedures. Barcode identification system. Donor signs consent in advance. Donor knows all implications. Donor gives authorization for analysis. Donor validates barcodes. Review of analytical results. In workplace drug and alcohol testing, negative results, sub-cutoff, can be issued directly to an employer. Positive results, however, are issued through a medical review officer, MRO. This person is often an occupational physician, who can assess the results from a medical perspective. Beating the test. The provision of a substituted or diluted sample is sometimes used to cheat the test procedure. Urine can be particularly susceptible to this because close observation of the sample provision is not always possible. All the urine collection procedures are designed to minimize the chances of tampering, and collectors are trained to be vigilant. Totally secure sampling will always be a compromise. To safeguard against this problem, adulteration testing is carried out on collected urine samples. Temperature measurement at point of sampling. Laboratory measurement of creatinine and urine density.